more than 40 years, People Incorporated has been an integral part of the greater Fall River community. Creative, collaborative, and invested in the region, we have consistently developed supports to make our community a better place to live. Dedicated to a better future for all our citizens, we are People on the Move. I'd like to welcome you to another episode of People on the Move. I am Bob Canuel, President and CEO of People Incorporated, and we have a very exciting program, a new initiative that's going to be starting here in Fall River that we want to bring to you today. And our guests are Karen Downs and Claudia Catalano from the Department of Public Health in Massachusetts, and Jenny DeBlasi, who is our Vice President of Community, Child, and Family Services. Welcome, ladies. A pleasure to have you on the show today.
Thank you.
So, Karen, I'm going to start with you. This is a new initiative called the Welcome Family Pilot Program here in Fall River.
Yes.
Could you tell us a little bit about how this program got started and what the Department of Public Health hopes that they'll be able to achieve with it?
Sure. So the Welcome Family Massachusetts and Welcome Family Fall River is going to be a universal one-time visit for all mothers giving birth in Charlton Hospital. And the idea behind Welcome Family is that we really want to welcome families to the community, to being new parents, and to sending a nurse into the home to provide a one-time home visit to speak with them about any concerns or issues they may have, and to really welcome them into the community and connect them with services that exist in the community for early childhood, to support an early childhood system of care.
So this program is going to be available to any person who delivers a baby at Charlton Hospital?
Absolutely. And one of the key elements of this program is that it is universal. Anyone giving birth at Charlton will be eligible for this service.
Wow, that's fantastic. Could you explain a little bit about the origin of this program? Because I understand that there were some national, federal programs that sort of led the state to want to implement this program.
Sure, and I'm going to turn that over to Claudia.
Okay.
Sure, I'll start. So this really came out of a bigger initiative, as you mentioned, at the federal level, out of Obama's Affordable Care Act, healthcare reform. And $1.5 billion was put into early childhood systems and home visiting programs. So every state applied for this type of funding, all states got it, and everyone's working to really expand evidence-based home visiting in their state. The feds put out about 9 evidence-based home visiting programs that states got to choose from, and we already had 4 existing in Massachusetts. That would be the Early Head Start program, Parents as Teachers, Healthy Families, and Healthy Steps. So the majority of the funding that we get at the department goes to expanding those evidence-based home visiting programs. But we also have built other initiatives around that, particularly supporting early childhood systems of care. And that's where Welcome Family really comes into play, because as much as home visiting is a wonderful piece of the pie, it's not the whole pie. And so we really want to make sure every family is getting services that they need, connected to something, feeling like they're part of their community. And Welcome Family is going to be able to do that and make sure that every family knows that they're in the community. They don't need to have an at-risk level to be hooked up to services. Everyone has questions. Everybody has concerns as a new parent, and this is really helping to provide that comfort and that connection in the community.
Oh, that's fantastic. Now, Jenny, you're obviously going to be the person at People Incorporated that oversees this program. What has your involvement been up to date?
Sure. Well, we were very fortunate that the Department of Public Health selected People Incorporated to take on this pilot. So for the past almost year now, my Healthy Families staff, so Joanne Bernier and I have been very involved with a committee that's been meeting up at the state in Boston, around planning what this will look like. So Fall River was one of 2 communities that were selected in the state to pilot this program, and so we've been working together as a team to come up with what this program will look like ultimately. We were brought in at the very early planning stages of the program, and even conversations around who would be doing the home visit. Would it be a registered nurse? Would it be someone else, a community health worker perhaps? And so all of those decisions we were involved in, and so it's been a great process, and which I think the best part of that is having been involved at the ground beginnings of it. We really feel invested in the program and really know what is expected of us from the department, and have been able to involve our partners in the planning. So since we've had the beginnings of the plannings, we've involved the folks at Charlton Memorial Hospital, South Coast Hospitals Group, who have been fantastic to work with. And so they've been involved in planning about how this is going to roll out and what this process is going to look like. We've also involved our community partners. We had a informational breakfast where we invited agencies and pediatrician, OB offices around what the program is and what we'll need from the community, and what the community will need from us as far as getting this program off the ground. It's going to be an enormous undertaking. We're looking at, in our planning, we're looking at roughly 1,200 births at Charlton a year of Fall River moms.
Now, see, that's an amazing number to me. I would have never, if someone had asked me, is it 100, 200, 300, I would have never guessed that there's 1,200 births a year in the city in Charlton.
Yeah.
That's a
And
large
that's just
number.
the Fall River residents, and if you get the surrounding contiguous towns, it goes up to about 1,500 births at the hospital.
Yeah. So given that every mom will be offered a home visit, we know that not every mom will accept for one reason or another, but we're still looking at substantial numbers of home visits that will be happening through this program, which is fantastic because as Claudia said, the wonderful thing about a universal program is that we know that all moms can benefit from information after they've had a new baby. You take the baby home, even if you have a lot of supports in your family. It's an overwhelming when you get home alone with the baby. And so every mom has questions. But further than that, there's, every mom could benefit from knowing where the, Mommy and Me groups are, or, how to access certain services, early intervention, and things of that nature.
Very important.
And then through the assessment, there may be moms who need additional services. Maybe they could benefit from a regular home visiting program where they have ongoing home visits. And we have models internally at People Incorporated, like our Healthy Families program, our Early Intervention Partnerships program, but there are also other home visiting programs available, as well as other services. So the really neat thing about this program is that we're going to be able to connect new moms very, very early on after the baby comes home with the services that they need. And so it will be a community effort because People Incorporated, while we have a lot of services under our umbrella, would never be able to provide all of the services that are identified through this. So there's going to be a lot of help needed from our community partners.
Right.
And I understand from the Department of Public Health's perspective that part of the choice for where the program was going to be located had to do with the fact that we had so many programs already available for children. I'm assuming that was a part of the selection criteria.
Absolutely. One thing that we did when we first knew that we would have access to this federal funding was we did an extensive needs assessment of every one of the 351 towns and communities, and we looked at many outcomes, maternal and infant health and child health and development, and we identified the 17 high-need communities, and Fall River was one of them. And we felt that we really wanted to work in a community that both had high need but also had high capacity and was really well connected to their community, so that whatever services we added to the array of services that already existed could really benefit everyone and could potentiate all the services that are being provided.
What were some of the other sort of statistical relevance issues that you looked at that are in existence in Fall River that led you to choose our community?
Well, also, I think just our relationship, not as much statistical, but our relationship with the People Incorporated organization, the supports and services that you all provide to your community, the real connection that's there in our relationship over the years has really made Fall River, and we've really been able to see the real connections that People Incorporated and other organizations in Fall River have really made with the bigger community. And we knew that Fall River was going to be a really wonderful site to start with, and a sort of an example for the rest of the state to see. It's a smaller community compared to like a large city like Boston. It's more representative of the rest of the state, and we knew it was a great place to sort of start going with this program.
And some of the indicators, some of the health outcomes that led us to really focus on Fall River were higher rates of teen births, for example, and higher rates of birth to low-income and new immigrant families. And those are people who are often lost within our system or may need a little extra support to get started on a healthy road. So those were some of the indicators that we were looking at.
And for us, it's really an honor to be a part of this project because we've redefined our mission statement, and a huge part of what we try to accomplish is creating those opportunities for people to gain greater control in their life and greater stability. And a program like this just is amazing in terms of what it can do in that area. So how are we going to get the word out to people in the community?
Well, that was, part of our planning process was looking at how we're going to spread the message that Welcome Families out there. Because again, we're not doing a targeted message. It's a universal program, so we wanted the whole community to be aware that this is going to be happening. So we have a bunch of different avenues that's going to take place. The first is the beginning stages of just getting people familiar with the program Welcome Family. And so any day now, a billboard is going to be going up on 195 on the highway that will promote the Welcome Family program. DPH, the Department of Public Health, has given us some guidelines around marketing materials, and there's a universal design that they've created so that we can brand the program. It's also going to be on the city buses. We have printed 5,000 brochures and posters, so getting that information out to the community partners. Additionally, we are working with the hospital, the OBGYN offices, and the pediatrician offices because there's many points that a mother can decide that she's going to take up on the home visit. Hopefully, they find out about it as early as possible. We did focus groups through our Healthy Families program, and there was focus groups held throughout the state with new moms, about the new program and how they'd like to hear about it. And what they told us was that they don't want to hear about it right after they've given birth for the first time. They want to be familiar with the program ahead of time. So we've already met with the OB offices, the physicians, and talked to them about the program, answered their questions. They're going to make our brochures and posters available in their waiting rooms, and we'll be able to talk to pregnant moms about the program at their visits. Charlton Hospital really has been a huge partner for us, and we are very grateful of how engaged they are in this program. And so what they're going to be doing is there'll be posters in all of the labor and delivery rooms. So from the moment that a mom comes in to deliver, the message will be given to them. They have packets that they give the moms while they're in the labor delivery room with various information, and our brochures will be in those packets. And then beyond that, the nurses after delivery will be going to the mom and signing her up for her home visit. For moms who decide not to take us up on the home visit at that time, there's still opportunities shortly after that they could change their mind and decide. And the pediatrician offices have voiced interest in getting the information so that they can talk about it and say, did you get your home visit? And if not, there's still time to sign up. So I think we've got a pretty good plan in place for how we're going to get the message out and get people. And of course, the TV show is another great way for people just to start hearing about Welcome Family and that it's something that's available to all moms.
So could you ladies talk a little bit about what would be your typical home visit for this program? Sure, all of you at once.
I'll start.
Okay.
So every home visit will consist of the nurse coming into the home when the mom decides she's ready within 2 to 8 weeks postpartum, and she will come with a welcome family bag, and within that bag will be a number of items: a swaddle blanket, a book, a rattle, a water bottle, a magnet where you can take the middle out and you can put the picture of the baby or the family in there for the fridge. So a number of items to sort of welcome the family and welcome the baby to the family, and sort of talk about infant soothing and bonding and attachment, mom's self-care and health, and promote a lot of those child and mother health outcomes. And then the home visitor, the nurse, will go through a series of questions and asking the mom sort of how she's doing, does she have any unmet health needs, does she have any concerns, does she have, how's her mental health and her emotional well-being, is there any potentially any other relationship issues in the family that she might need to talk about. How about her health and nutrition? She'll go through a series of 5 key areas, and all the while letting mom sort of, lead the conversation, and then saving also a portion of the time for mom to ask her own questions. Anything that is bothering her, any concerns, just anything that is on her mind, the mom will be able to ask. And we encourage other family members to attend that visit if the mom wants them to, or if they care to, and really make it a family-centered visit. Eric, want to?
Yeah, so we have maternal infant health nurses who will be going out and doing the visit. Very experienced nurses who are familiar with how to care for a mom and a new baby, but also about how to do home visits, and it's very different than being in the hospital. So we'll be giving these bags to the mom. If there are any services that are identified or types of services that are identified, the nurse will talk to the mom about what types of services are available in the community, and then we'll bring that information back, and our program assistant at the office will actually make the referrals for mom and help make that connection. And then after the home visit, about 4 weeks after the home visit, our staff at the office are going to call mom and find out how the visit was, how she was able to connect with the resources that we connected her to, if there were any barriers, helping make sure that we make those connections, so that while it's only one home visit, we want to make that home visit as effective as possible. And so we want to break down any barriers that mom has as far as connecting to the resources or services that she identified that she needs. And then we'll be, collecting data on the types of referrals we make in general, and being able to work with the community around if there are any service delivery gaps, and if there's huge waiting lists. How do we kind of help in general for moms, new moms? How do we help kind of make the system flow a little easier so that there's less barriers to accessing services?
And I'm assuming that, given the fact that you already operate, our first community center, not only at our main corporate headquarters, but also at the Laterno School.
Right.
And we have other branch offices that we'll be able to provide an enormous amount of other supports for families that are a part of this program.
Absolutely. I think that was another key. So we have the home visiting experience. We have many home visiting programs that we have experience providing. The experience connecting residents and families to resources in the community, and our staff are well trained on what's available. We have great relationships with the community agencies that provide the services, so we're able to pick up the phone. We know who's on the other end, and we're able to help facilitate those referrals. And so I think that gives us a definite advantage, and it also gives us an advantage that we have so many of those services. We were in another meeting where we were talking about this, and Beth, who's another one of the Department of Public Health staff who we've been working with, said that the nice thing about People Incorporated and what we'll be able to offer is that we're able to provide a warm handoff rather than only connecting moms to services that they're not familiar with. They'll already have a comfort level with People Incorporated, and we have so many services under our roof that there'll be an easy transition that we can say, Bev will be coming out, and this is the program, and that sort of thing. And I think that will definitely give moms some ease around having people coming out in the home, because sometimes that's a barrier. And sometimes the barrier is stigma. And so we've talked about how this program is going to tremendously help reduce the stigma that's associated with home visiting programs, that really home visiting can benefit anybody.
Yeah, and I know, Karen, you spoke earlier in the show about some of the immigrant populations.
Yeah.
And I know from previous work I've done throughout my career, it's a daunting task for people who are not familiar with some of the services that are provided in our country.
Absolutely.
To be able to go to this large institutional agency and get a service, and I would think that being able to go right to the hospital and as Jenny mentions, the fact that we're already seeing many of these people through a lot of programs is of huge importance to helping these families feel comfortable.
Right, absolutely. It's been part of our mission at the department to really look at health disparities and differential access to services for certain communities and certain populations within the communities. So by having a universal program and by having a universal program that really tries to provide services within the cultural context and in the language that different people speak is critical,
Is critical.
and piece of the key to the success of the program. And I think the capacity for People Inc. to serve a wide range of people has been one of the factors that really led us to choose People Inc. as the agency that would.
Now, you mentioned a while ago that it's an evidence-based program. Could you speak a little bit to what that means and what some of the evidence has been already in states where this model has worked?
Sure. So I can start and then I can pass it again. So the evidence-based really refers to the more ongoing home visiting program, so like the Healthy Families program that's already existing here in Fall River. So the federal government did a very comprehensive assessment to determine what of all the home visiting programs in the country, what was determined to be evidence-based. And they did a pretty rigorous examination of all the different home visiting programs. So it really depended upon a lot of what they're called randomized controlled trial studies to determine the outcomes of a home visiting program. So the Welcome Family program, it is a new program. We're developing it from scratch and really looking across the country to see who else has a similar one-time or very limited number of visit program, and what are they learning. And so at this point in time, none of the very limited programs like this are deemed evidence-based by the federal government, but they're all moving in that direction. And there's been a lot of trials and studies done on these type of programs to start showing some of the outcomes and building towards that evidence base. And so we're learning from our partners in North Carolina and Durham County, from LA County and Michigan. There's a number of programs that are starting. Some are a couple years off the ground, some are like us and just going forward. But they're seeing a lot of positive outcomes for families. In addition to high connection to services, we're seeing about 85% uptake in families wanting the service. So it's an incredible number. We're also seeing reduction in hospital readmissions after families receive that one-time visit or two-time visit. There's a higher uptake in families attending the well child visits and a higher identification of families that have postpartum depression. So those are some of the key areas that we're seeing, and we're hoping to show some of those outcomes as well when we start to pilot this and get it off the ground.
So we're seeing, in essence, the potential for healthier children earlier. And greater stability in families, especially postpartum is such a difficult assessment to make very often, and such a critical issue to be able to resolve early.
Absolutely, and it's very underdiagnosed. A lot of families don't understand that they have it and that it's very treatable once identified, and also really just building the connection with a greater healthcare community with the pediatricians and the OBs and the family practice doctors, and really making it a continuous service model in the community.
One thing I want to add to that is that there's a lot of emerging research on the importance of those very, very early months. That's when a lot of brain development is happening. And so not only is this a benefit to the mother, but to stabilize that mother-infant relationship, or the role of the infant within the family, can have pretty significant long-term impacts for that child, and can lead to higher rates of school readiness and lower rates in adolescence of truancy and other issues. So there's a lot more research by Jack Shonkoff and other researchers that really emphasize the critical, this as being a critical period when intervention and really connecting that child to his or her family and to his or her community can make a huge difference.
Excellent. You know, you mentioned a couple of times, Jenny, about, you know, the hospital relationship, and you know, I've always believed we kind of live in a new world when you think of the way things were 20 or 30 years ago. And when I look at, as you folks I know have already seen, at communities across the country that are having pockets of excellence, so to speak, it really is the collaborations of groups that had not typically collaborated, and the idea that we now have this emerging collaboration with a hospital is pretty exciting to me, because it opens the door for so many other opportunities.
Absolutely. And you know, it's been it really has been amazing at how excited the hospital, both administrators and the nurses, have been about this program, and about how we can, you know, work together. They've invited us to, the hospital has invited Claudia and myself and some other folks to the hospital to meet with the nurses. So we've done that on a number of occasions, and actually spoke with the nurses about what the program's all about, and just really the enthusiasm there. And I think really there are a lot of opportunities for you know, other collaborations down the road, and even some of the nurses who work at the hospital were so excited about the program that they've been applying to do some of the fee-for-service nursing hours in the program, because it really is such a critical intervention and for prevention, which is something that I've always been really interested in, and is a huge focus of the CCFS division. Is, you know, getting in early and supporting families early on.
I can't believe it. It's been really wonderful talking to you guys about the program. We have actually run out of time, but we'd love to have you folks come back maybe in a year from now and talk a little bit about some of the results that we've been able to achieve. And for those of you out in the listening audience, you know, if you have a family member who may be expecting, we certainly will have the numbers posted, but please give us a call. We can make sure that all of these services are available to anybody who is a Fall River resident in the community. And I'd like to thank you for tuning in to another episode of People on the Move.